Hello and good morning. This is Dr. Katie from Craig Chiropractic and Kinesiology. And today I wanted to do a short video talking about multiple chemical sensitivities. So firstly, we're going to describe what those are and what that looks like. Now, multiple chemical sensitivities is a type of medical condition that can go by several different other names depending on where you're from and the type of medical provider you're seeing. It can also be called things like idiopathic environmental intolerance, environmental illness, just plain chemical sensitivities. There's other fancy terms like toxicant-induced loss of tolerance, environmental sensitivities. So you get the idea here. Essentially, chemical sensitivities or multiple chemical sensitivities are a type of medical condition where the patient in question is sensitive to various scents or chemicals. Now, this can range from very mild to severe. So I think the most common symptom of this or example would be someone that is very sensitive to things like perfume or hairspray. Pretty sure we all know someone in our life who is sensitive to those things and with things like headaches or feeling unwell. Okay, now that can be more of the mild case where someone smells a perfume or scent that makes them feel unwell, generally speaking, and they need to get away from that scent or go get some air. Okay, in more severe cases of chemical sensitivities, the patient in question may actually get symptoms as severe as brain fog, speech slurring, loss of muscular control, trouble speaking, disorientation, dizziness, vertigo, nausea. The list can go on. Now, again, those are more of your severe chemical sensitivities. Now, people can react to virtually anything that has a scent. Now, usually the worst ones are artificial scents, so like a synthetic perfume or fragrance. This can be found in everything from perfumes and colognes that we wear all the way up to things like laundry detergents, etc. Any kind of scented product, cleaners, for commercial bathrooms, dryer sheets. These all can trigger reactions in those with chemical sensitivities. Even things like pure grade essential oils, which again, they have many therapeutic benefits, they are wonderful, but those that have severe chemical sensitivities can still react to some pure grade essential oils, okay? The trouble with multiple chemical sensitivities is that the person's body has a hard time breaking down the chemicals. So to understand something, if you breathe in something like a perfume or a scent, not only does your body recognize it and smell to identify, what it is, like, oh, this is a fruity smell or this is a stinky smell. Not only does your body identify it, when you're actually breathing the chemical or the oil in, your body has to break it down and detox it. And some people's bodies are better at this than others. Those with chemical sensitivities struggle to break that down. Their liver has a very hard time detoxing it. So instead of quickly, detoxing it and passing it through, it tends to take longer and it's much harder and the body goes through more distress. Now, doctors have argued for years on if multiple chemical sensitivities is a real medical condition that people deal with. So is it a physical condition or is it just a psychological mental condition with these patients? And I would argue that it is actually both, okay? So I will say this is a real physical condition that patients can deal with. I myself, as a medical provider, know that I deal with a mild version of this. So certain perfumes, scents, and even some select essential oils will cause a reaction for me, okay? I also have some close family members, friends, and multiple different patients that also deal with severe multiple chemical sensitivities where they will have much more severe reactions. So I can testify this is a real medical condition where these people really do have physical responses to an actual physical stimulus like a perfume or something else. That being said, I would say there is a psychological component. For those with these sensitivities, it's very, very stressful to get exposed to a scent and know that your body is going to start feeling ill, that you're going to lose your ability to speak, you're going to get brain fog, you're going to get pain. So for many of those, they do develop psychological problems, if not fear response, almost, I would say, trauma response. So if someone goes out and another person walks past them with a very strong perfume, the person with the sensitivities knows they're going to start feeling ill, and their body can start going into almost like a trauma response. So yes, it's possible to have both psychological responses as well as physical. Now, in a follow-up video, we'll talk more about things you can do, but I just wanted to bring a little bit of an understanding so we can see what chemical sensitivities are. Thank you for listening.